What if everything you thought of health and wellness suddenly changed due to a hidden breathing problem that you were unaware of that affects every system in your body? Improper breathing habits are often overlooked in medicine. I'm Dr. Jenny from the Hobson Institute, and this is the Breathing Lab. So everybody, thank you for joining. I'm so excited to be here with a very wise woman. This is Dr. Silke Heine. Silke is born in Dusseldorf, Germany, spent 11 years working as a buyer in the German fashion retail industry. She ended up moving to the United States with her American husband and 2 children. Silke started studying many holistic nutrition topics with various programs and universities. Silke has her PhD in holistic nutrition and is the owner of Simplify Holistic Nutrition Consulting. She spent the last 20 years studying the relationship between health and food and helps her clients find the bio-individual way of eating, matching their conditions and goals. Because Silke has concentrated for many years on the topic of anti-inflammatory diet, she partnered with KBMO Diagnostics and offered the FIT test, food inflammation test, in her practice. KBMO Diagnostic added Silke as their head nutritionist, where she was leading a team of 10 meal planners to create a sample 7-day meal plan for the FIT 132 and the FIT 176 tests for providers all over the world. She stopped doing this a year ago, which she stopped doing a year ago. Silke has clients from many countries who have heard from her. Many order the FIT test on Silke's website, and she reviews the test results in her office or with her long-distance clients over Zoom, like I did with her myself, or on the phone to implement a new way of eating according to the FIT test results. Silke has earned the following degrees. In 2007, a bioenergetic nutritionist from the Healthy Living Institute. Dr. Mark Mincola, 2010, a bachelor in holistic nutrition from Clayton College. With the highest honors, 2013, a master's degree in holistic nutrition from the University of Natural Health with summa cum laude. 2013, certified natural health practitioner. She's got a list of things. Certified holistic nutrition practitioner in 2014, PhD in the holistic nutrition from the University of Natural Health with summa cum laude. In 2019, certified functional medicine health and wellness coach from the Functional Medicine Coaching Academy in 2021. She's certified international sports nutritionist from the ISSA 2022. Certified functional nutritionist counselor from the Function Nutrition Lab, Full Body Systems 2022. Certified gluten-free diet practitioner from Dr. Tom O'Brien since 2015. Part of the integrative practitioner group that meets annually in New York at the Integrative Healthcare Symposium, a conference led by the Institute of Functional Medicine. I'm going to just say, wow. I am so impressed by Dr. Silke. What an amazing list of credentials. And, just to let everybody know why I'm actually interviewing Silke is that she actually did my test, and I was introduced to her by a very wise dentist. His name is Dr. Felix Liao. Silke, I'm a physical therapist that trains breathing. I'm a TMJ head and neck PT that has been helping people for over 20 years around problems with their head and neck. And these dentists that I partner with have problems with patients with these problems, and I'm the functional person. I'm the functional person that helps them feel better. But we're all about nose breathing. And Dr. Liao trains doctors, dentists, how to expand palates and make their mouths bigger so that our noses work better and our throats have more space for our tongues. So that's really why we even got connected. So I'm grateful for you being here. Thank you for joining us and
Thank
spending
you.
the time to share your knowledge.
Thanks a lot.
Yeah.
Thank you for having me, and thank you for everybody zooming in.
Yes, yes. Okay. And we're all about breathing. And as you know, foods can change breathing. Foods can change congestion in our noses. And that's why I'm I'm an ultimate person trying to change my own congestion, my children's congestion, my family's congestion, my patient's congestion. I learned about you and I really was intrigued that there was a whole other part of learning about breathing that I didn't even consider was food. So here's my first question to you. So, okay, you have such a unique journey from fashion retail in Germany to becoming a global expert in holistic nutrition. Can you walk us through the transition you made and what inspired that shift?
Yes, thank you. Thank you for asking that. I moved here to the United States. Well, in Germany, my fashion work was, and being a buyer, I was on airplanes all the time. And it was a lot. And then I stopped working to get pregnant, had my 2 children, lived in Berlin at that time. And when my husband and I moved here with our kids to the United States, I got really sick. And there was nobody to explain to me. I had many different doctors. Everybody tried to figure out what is going on. And there was nobody who really knew about nutrition. And I felt whatever I do is different and makes me feel different, worse, or maybe a little better, but there was no real answer. So I started studying nutrition because with my German brain, I guess I wanted to really analyze this and dive a little deeper. And that's what I'm trying to do with my clients, really, to find answers for them and hand it over. I wish somebody would have done that for me.
So you hold a PhD and several certifications across holistic and functional nutrition. How did you decide to specialize in inflammation and food sensitivities? Is it because of your own issues?
Yes, so that is a big topic. I think, well, when I started studying, maybe during my master's degree, I realized that these are topics that are very dominant. I mean, now it's so, first of all, inflammation, food, and an inflammatory response. I think it's really important for people to alkalize themselves, but that's a different topic. That's not the topic for tonight. But and when I put these concepts together, I saw and realized how amazing my clients can feel. So yes, inflammation now is also is during COVID, so much research came out that confirmed that inflammation is really at the bottom of all chronic illnesses and opens the gateway to autoimmune conditions. And that is the research is there, and I think, I mean, I see the changes in my clients, and they are amazing.
So you've spent years focusing on anti-inflammatory eating. For our listeners new to the concept, what exactly is inflammation in the body and how can food either worsen it or calm it?
Sure. So generally, inflammation does not necessarily have to be bad. So an acute inflammatory situation is a healing response. And for example, if somebody gets stung by a bee, or has an infected mosquito bite and experiences throbbing pain, all nutrients are pushed to the site of injury to correct this, to heal. So generally in the medical textbooks, inflammation is described or defined as pain, swelling, and redness. So with that, but if low-grade inflammatory responses are just stretched out, it opens the gateway to everything we all don't want to have.
Wow. So how does the FIT test then work? So you partnered with KBMO Diagnostics Lab. What sets this test apart from traditional allergy testing? Because I've had the pricks on my back, and I never really understood what's better? I always wanted to know, am I gluten sensitive? Is the pricks on the back, that testing and the skin versus the fit test, and how is it different?
So first of all, there are different reactions to food, and that is very important because people, I think as society, we all talk about allergies, or my clients talk about allergies, and there are big differences. So an allergic response is an immediate response of the immune system reacting to a substance in the first 20 minutes of exposure. Those are called IgE antibody responses, and that is I have clients who come to me and they say, I do have allergies, and shellfish allergies or whatever it is, but I seem to be able to get away with it if I eat it a little. And I don't recommend that because allergies also cause inflammation if people ignore their allergens. Then there's another topic that I know you didn't ask about, that food intolerances. So food intolerances, I tell my clients, belong to a gastroenterologist. Those are often really gut health issues. Somebody could be lactose intolerant, and that also needs to be tested. It's often tested with endoscopies, colonoscopies, and that is also as a reactivity time in the first 25 minutes also of exposure. That's important. I mean, most people who have a food intolerance and experience this once or experience this often, they go and seek medical advice. That is really important. And then then there's of course celiac, and autoimmune condition reacting in the small intestine to gluten. And most people now know what that is. 30 years ago, nobody knew what celiac is, but it's pretty dominant now in our society. And so these food sensitivities that I work with, and you and I love so much, are delayed food sensitivities, so-called IgG antibodies. And the FIT test is the only test that I found in the world that has paired also 4 IgG antibodies can be tested for, and the FIT test tests for all 4 plus an inflammatory marker. So the designer of the FIT test, Dr. Brent Dorval, a PhD from MIT, has made this part of his life work. And I've learned a lot from him. We worked together really for 10 years. And when I created all these meal plans, and the test is phenomenal. The biggest difference is, so it does not show allergies. It doesn't show food intolerances. And I always explain this to my clients. So not that somebody believes, oh, great, I'm not allergic to shrimp anymore because it doesn't show in the FIT test. So, and that could potentially be dangerous, but the FIT test really narrows it down to this inflammatory response. And that is a time frame the general person gets inflamed, has inflammatory reactions 2 to 3 days after being exposed to something. So then it's really hard to pinpoint back. But also the reactivity time has to do with the speed of metabolism. So my 3-year-old clients might get eczema in 8 or 10 hours after being exposed, and every person is really different. And I have 85-year-old clients who react in 4 days with an inflammatory response and have no idea why that is. So this is where these FIT tests are really eye-opening and so have been beneficial.
Now, in your experience, what are the most common foods causing hidden inflammation in your clients? Like for me, I was surprised it was lime. I mean, you think lime is healthy, my husband's putting it on everything.
Yes, I remember you telling me that. I have used to call them, so the lab started, and I always say we, even if I'm not their head nutritionist anymore, but we started with this panel for the FIT 132, and now have expanded to the FIT 176, and the numbers stand for the amount of foods tested for. I also work with the FIT 22 that tests for the most reactive foods we have seen or the lab has seen, which is also pretty interesting. So the FIT, so generally I used to call them breakfast foods. I think people have changed their breakfast habits. Not everybody is eating bread or whole wheat toast with eggs and eats a yogurt. So clearly those. Whey protein is a big one. Casein, so cow's milk, dairy items consists out of 80% casein and 20% whey protein, and that is very interesting. Gluten, wheat, barley and rye and spelt are all glutinous grains. So with that, and now we have added these gliadins, which are gluten peptides. It goes a little deeper down into the structure of this grain and or into this gluten protein. And if people are gliadin sensitive, I believe they are clearly gluten sensitive. But those are probably the biggest. And eggs, since eggs have been defined as for people as not being so dangerous in medical science for building cholesterol. The egg yolks only have cholesterol. But since then, I have so many clients who have chicken in the backyard and they love their eggs, and then they start getting sensitive to it. And that's another interesting point. The reason why people react in this food inflammation test as they do is either they are sensitive to an item for life or they have overconsumed something. And where that is visible with the second test, not with the first, unfortunately. But it is very interesting and very helpful to know.
That's interesting you say that, because I used to have a both yolk and white egg sensitivity. And because I took a test a while back, it wasn't a KBMO test, but I took it again, and the yolk wasn't there. It was a little bit of problem with the white. And so can you explain, just sometimes you get through these sensitivities and you don't have them after a while? Like, how does that work?
Yes, so I'm pretty strict with my clients because I feel when they invest into this, they are usually ready to hear my approach, and they are doing very well. So yes, I want my clients to remove the foods as much as possible. So in the lab, we have seen that 6 weeks of consistent removal really people start to learn how uninflamed they can be, how good they can feel. And of course, that has to do with anything else, with toxic environment and all kinds of topics and healthy eating in general. But that is my first recommendation. And then especially with severe and high and moderate reactions, I like my clients to stay away from these foods as long as they can. I mean, that's not always possible. Birthday cakes are fine, but beyond that, and then sometimes my clients come back and say, so I'm getting impatient. I want to see if things have changed. For kids, I always see healing. A lot of kids can really get rid of their food sensitivities. I got rid of my wheat and gluten sensitivity, and I'm German and grew up with bread and cake, but everything always super fresh and freshly made from the bakery. So I got rid of my gluten sensitivity in 8 years of avoiding it, and it doesn't appear anymore it sounds very long, but for kids, I always encourage the parents also that healing is possible. But yes, so I think that makes a big difference.
Yes. And you know what? Just wanted to remind everybody, if you have questions, please put them in the chat now. Just want to make sure you have time to review them. I myself was surprised. And just when you take the fit test, I just want to explain to everybody, you get this little card that has 5 little circles that you prick your finger and you put the 5 drops into, it's a blood test. So that blood test then gets evaluated, and I'm sure you can go into some detail around that. But what I was shocked at, with this information, I've got a sample week of eating, and for me, it was Lyme, it was dairy, and I kind of knew dairy caused mucus and production in my nose, or it would always congest me. But I learned that I had Candida and a form of leaky gut, which I would have never knew. And Silke, I just have to thank you so much, because I was strict. I was very strict. I was strict to the point where I was going on vacation and meeting you in the car, driving to my vacation. My husband wanted to kill me. So there was no beer, there was no wine. Now I did do vodka and soda because I knew you can't have, when you have Candida, you can't have sugar, you can't have fermented food. So the beer, the wine, the Prosecco, the bread. So I took it all out, and I was strict for a good, I want to say 3 months. And all the swelling, the bloating went away. And then I went back to like, okay, I went on a different vacation, and I was a little less worried. And within a few days of me being careless, I started feeling it again. I started feeling my gut pain. I'm like, oh shoot. Okay, so when does the Candida go away? I don't know exactly, but if I know if I don't eat sugar, and if I just eat the fruit, my dessert now is yogurt. It's like cashew coconut yogurt, granola, and fruit. That's it. And no sugar, no honey, no nothing. And stevia if I want to do anything. If I'm strict about that and only have an occasional cake because I'm at a party, or a glass of wine but if I'm normally not, I'm good. And if I have a little slip, it's okay. But it's not like my chronic bloating that I've had. So I just have to say, thank you. Thank you for helping me. And thank you for helping my family and many of my patients. Because we are in a cycle of habit. We are creatures of
Yes.
habit.
Yeah.
We go in and do the same thing every day, but if we don't know what we don't know, and we don't know what is causing us harm, we wouldn't change it. So this test to me was just, it's spot on. It's individualized to you, and then you, with all your knowledge of all the things you've learned and your training, you helped. My family is tricky because children are tricky to change diets, and you know that. It's like, and we're better. Of course they weren't as strict as me, but we're better. And I told him, I said, we're doing this once a year. You're gonna have to deal with what you learn, and you're gonna deal with deciding what you want to eat, because I'm going to go with what I know is helped me, and this has helped me. So I plan to do it every year with you. Get an assessment, get a recommendation, and then it's up to them to keep it up. But then the next year it's going to come back. So that's my plan, at least.
And that sounds lovely. I think, you have a wonderful family, so I think that is a good idea. And clarity about all of this is a good idea, and good to get them on the right path before they go to college and make their own choices.
Yes. And as a sports, like my daughter and my son are athletes. You talk to them like athletes. I think that changes their mind around, oh, okay, I have to listen. I'm an athlete. I want to go to college. I want to be a D1 water polo player. I have to listen.
Sure.
So I think, and your certification around that is it's very, people need to know that there's a place to find out exactly what they need. And I think that's what you've been able to provide for me, at least. So anyway, I appreciate that. I wanted to just ask a couple more questions. You and I work in the airway and breathing world, and we've talked about how inflammation, even from food, can impact nasal breathing. What insights have you gained about the food-breathing connection?
So I was asked by the lab to do this, to consult what I've been doing with you and with your patients, to consult this whole group of people who joined this AMD trial, we call this. It's not a clinical trial, it's a trial to prove or to show what is happening in the sinuses. The throat is connected to the sinuses, and you know this much better. And I had many clients who very much did benefit from removing the foods. Yet with this connection, a lot of people swell up in their sinuses. If this is an allergic response or if this is just an ongoing inflammatory response, and mucus can be a form of inflammation. We have a mucosa all over our inner skins. So with that, I believe, and a lot of kids I have had in this trial, about 100 people so far, patients, and that was for me also a great experience. You talk to your patients on the other end, and you see how it impacts their health and their breathing. But from what I have learned, really, especially also children, that there is so much we can do, and then they breathe better. And as you described for yourself, the sinuses are not swollen. Sleeping is a huge topic for children. They can come to peace if they feel all stuffy and congested. But and then of course there's an anti-inflammatory diet for everyone. So sugar, you mentioned sugar in the connection with Candida, but of course sugar, chemicals, artificial sweeteners, they all, and there are many other, and of course always the unhealthier food choice is causing more inflammation than, for example, so the supermarket beef compared to the grass-fed beef is completely different than, and reacts different in us. So, and that's important.
Yes, yes. So how can someone begin to connect the dots between their digestive symptoms, their sinus symptoms, and what they're eating? What do you think how can they connect the dots there?
They should take the FIT test, and they should work with this gut barrier panel. I think, and we haven't really talked about this gut barrier panel yet, but there's so much information in there. And so the gut barrier panel that is attached to the FIT 132 and the FIT 176, and now also available with the FIT 22 for I find very generous deal from KBMO Diagnostics, is tests for Candida. Candida is an overgrowth of yeast in the small intestine. It tests for leaky gut, zonulins, and occludens, and also for lipopolysaccharides, which is a much more scientific, more complex topic. But with that, if people have red flags in there, usually children do not. All what I've seen, and I've created, I don't know, maybe 200,000 meal plans for KBMO Diagnostics in those 10 years, and always compared them to the meal plans that my team created. And I don't see children, which I find very encouraging, with unhealthy guts. It's usually food. So maybe teenagers that start having Candida. Candida is tricky because it, as you know, and I know that myself, I'm one of these people. Some people are mold sensitive, and Candida, yeast, and fungus go hand in hand. Candida is a fungus in the small intestine, but it is. We all have some Candida, but if it's outrageously high compared to the good microbes, then of course it impacts our health, and not just with bloating and congestion, but also brain fog, really anything from diarrhea to constipation, muscle aches. My older female clients get chronic UTIs, respiratory tract infections, and all caused by Candida.
Yeah, I remember when you and I met, I always had a pain here in my right lower tummy.
Mm-hmm.
And I wanted to just share, like, people that have bloating and they have pain, it can actually be an inflammation of a sphincter or something happening in their digestive tract. The way you explained it, I don't know if you could do that right now. It's okay. That was so explaining how the food moves down. And to me, I just feel like we have such a disconnect. We just kind of bring food into our bodies. We don't always think about what we're ingesting. And we obviously also don't always chew our food the way I would like everybody to be chewing, and using their nose when they breathe, when they're chewing. But the way of describing, I think it was my ileocecal valve that was causing me problems. I haven't had that pain in so long, and I'm so grateful. But abdominal pain means something. Sometimes it's organs, sometimes it's digestion.
Yeah.
I mean, could you share a little bit about that?
Sure. So just to get everybody on the same page, I mean, I can also stand up and explain this
I would love it. I
where
would
goes
love
what.
it.
So we eat. Yes, chewing is really important. I mean, you're a dentist, so and eating in peace, mindful eating is very important and is covers already a huge part of the digestion because it's easier to digest. Period. And so food goes down the esophagus, and here on the left hand side, underneath our rib cage, is like in a pouch our stomach. When food arrives there with acids, enzymes from good healthy food sources, but also from the process of digesting, they get all churned up into what is called chyme. And chyme then moves when it's ready to move, goes into the small intestine. Small intestine winds its way down here. So from the navel to the groin area, this is where this windy tube is works its way down. And then in the right hand corner, and I'll explain more about the small intestine, in the right hand corner is this ileocyclic valve that pushes the fibrous leftovers into the colon and that is what forms stool and goes up here, the colon goes around here, goes down here, and people go to the bathroom and eliminate themselves. So the small intestine is the longest section of our gastrointestinal tract, very important. And it is 22 feet long, or for my European friends, 7 meters. And in there, first of all, the lining of the small intestine is very thin. It's a one cell lining, so it's a see-through skin. It has the thickness of a quarter of a sheet of paper. So it's very, very see-through and sensitive. What's happening in there, it's the most important part of why we eat healthy. Nutrients are absorbed into the bloodstream. And this is what then, and in from the blood, then the blood cruises through our whole body and gets to all the places to keep us alive. And that is what is very important. In the small intestine are about 30 trillion, we think now, 30 trillion different microbes. So, and Candida is one of them. But if it's too much, again, then it's not okay. And this leaky gut topic is not as dangerous or as scary as we think, but we need to know that we have it, because then we can counteract against it. It can be healed, I would say, in theory, in 3 to 5 days, but maybe it's not so fast. And leaky gut means that at the inside of this windy small intestine, we have these finger-like villi, and they need to be tight gap junctions to not allow any undigested protein or inflammatory foods, and with this food inflammation test, into the bloodstream. Here's the bloodstream. So if this gets inflamed and gets a little porous, then people experience leaky gut. But we need to know, we need to take the foods out that people are sensitive to, then the gut can heal. And depending on what's going on, I recommend also supplement intervention, and depending on the age and the health situation and the willingness. But yeah, this has been so helpful. I mean, my clients usually do not come back after I consulted with them. So you hear the stories now from your patients, and that would be interesting to hear. But my clients then refer me to they hear the same story and they say, oh, you have to go see Silke. And then I always ask, how did you hear about me? And then I hear that, I don't know, somebody lost 30 pounds in the last month, so it's got rid of their joint inflammation or breathing topics, lost weight, gut health, and are not bloated anymore, and I don't recognize them. This has been very rewarding.
Yes, I can tell you, 15 pounds I lost without even working at it. It was pretty incredible. Like, and I didn't really feel like I needed to lose weight, but when I lost the 15 pounds, it felt so great. And I think your body just works better when it's less inflamed. So
Yes.
I wanted to, before we wrap it up, there's a few questions that have come in. This is from Gemma. I had the allergics antibody profile IgG4 food reaction test, blood, and had severe egg white and yolk. I don't know if it's an allergy or what, but I had been sick for 20 plus years. I do not eat eggs, but will have pasta, bread on occasion, and seem to be okay. Should I give up eggs completely?
How about getting retested? I mean, I would, yes, generally, but an IgG test, I took an IgG test 24 years ago. It said on the panel, it was an LCAS test, and it said on the panel, IgG allergy test. IgG responses are delayed and not an allergic response. So I would retest. There are small tests. There's this FIT22. This is not very costly, and you could just test in there also for 22 foods, but egg yolks and egg whites. And the egg story has become a little more complex because we now, as consumers, eat bread that is has more protein in the ratio to carbohydrates. It was almost all carbs, and we want now more protein and avoid more grains. So these are sprouted grains that then have a higher protein content, and they would literally fall apart into crumbs if we wouldn't use eggs as a binder. So eggs are more around than we used to have them.
Okay. Second question. Do you recommend everyone take a FIT22 test?
Or, I mean, this is really a matter of affordability. I would suggest the biggest test because you get so much out of it. But I don't know where I would be with my health. And this was interesting. So when I got so sick and nobody really knew, and then at this functional medicine conference in New York that I attend, I met the owner of this lab here, or the CEO, and we started talking about it. And so since 12 years, I have been using the FIT test, and yes, things totally change. My husband, for example, is the most sensitive to basil and cilantro. He gets a bleeding rash when he eats a speck. So it's this detailed, this test. And if we would never know, he would probably be on steroids since 12 years, and we are able to avoid it. I cook everything from scratch and love that. It's my biggest hobby, I guess. And he is medication free.
That's great. Okay, next question. Also from Gemma. Dr. Hobson, could you say more about how we eat? The nose is involved. So the reason why I connected with Dr. Silke would be because of my journey is around always using your nose, breathing through your nose, and reducing congestion and clearing up congestion. So if you have inflammation transmits to different parts of your body, and the nose is one of them. Like for me, I drink red wine and boom, my nose plugs. And I've finally to a point where I'm not doing it anymore. I'm not. So you have to kind of understand what congests you. This test is not that expensive. Once you know what you know, you can get retested. Like the Candida and the leaky gut, that test is a lot less expensive, I think, to just see how you're doing. I haven't done it again yet, but I want to. I think that milk, a lot of people have, that's one that I've heard before. It's like milk can congest you. Ice cream, that kind of creamy stuff. Whenever I went to a restaurant and ate like really buttery, creamy stuff, oh my gosh, my nose and my tummy. So that's what I mean about how's your nose involved. We want to make sure that if you eat, you want to eat with your mouth closed and use your nose. If you're plugged all the time, you're going to be mouth breathing and chewing sloppily and having food kind of
on your face. Some people never learn that, even children to adults. They become adults and older people that still are using their mouth to breathe while they eat. So that's my comment there. This is another one. Are you going to share with us how we get a hold of someone who can test us? Okay, so that's a good question. Let me go back to my notes. Hold on. So I myself in Chicago, we are providing the fit test. And what I do is I evaluate everybody for their breathing, for their sleep. I want to make sure that people are as healthy as possible. We're considered kind of a wellness center here in Chicago. And we've been helping people with chronic fatigue and just a lot of the general stuff that people deal with. Well, your diet, how good you feel inside, how you sleep, how you present yourself to the world, that's all important. And for us, we think we want to provide that as a wellness portion of our clinic. So we provide it here. Dr. Silke, you also provide it on your website. So I was going to say, how do people get a hold of you if they want to work with you?
Of course, my website, my business is called Simplify Holistic Nutrition Consulting. I don't know if this can be visible in any, maybe in the chat box. You can.
Yes, I can put it in right now.
You could also email me. I work with people all over the world. And when people pay me on my website and send me their waiver that I know how to contact them, then I ask the lab to send test kits. And I'm able to do that because I have been working with this test for so long, and the lab refers to me. So I don't think that everybody does that, but that works. And you can also email me at silke@simplifyholisticnutrition.com, and we can talk on the phone. I generally I try to reach my clients the days they call me or contact them, and work 7 days a week if everybody needs to be covered. So I am available.
Wonderful, wonderful. Okay, I think, let me see, is there any other questions? The fit test is the test is the fit test the test to get? So there's several fit tests, food inflammatory tests. The one I think is the best, is the biggest one, I think, is the 176. It's 176 foods, and it also includes this the gut barrier testing, which shows you if you have Candida or leaky gut. Is there anything else you would want to say about that?
No, I think they are. So all tests now include the gut barrier panel. So the two big tests, the 132 and the 176, is included in the price. The gut barrier panel. Now there's the Fit 22 for small children. I believe that's a great start. They don't necessarily need a gut barrier panel. So the Fit 22 is just without the gut barrier panel. Now there's a new version, the Fit 22 Plus, where the lab has added to the Fit 22 this gut barrier panel. And everything that I do in my business, these are package deals because I send them all over the world and have a requirement according to the lab to not just sell. Well, in my business, it's different than in yours. These are package deals because I have a contract with KBMO and I'm required, as you are too, as a doctor. I can't just sell tests and hand them out, and the lab doesn't work. It's a blood lab. They don't work with clients or patients. So you always need a provider for fit tests. And then in my business, I have package deals really from my experience working with these tests, how much time I need to explain test results and consult, and this is what you pay for. So you can go to my website and look at that, and in the price is only my consultation fee that is added, and the lab charges me the minute a protein sampler card with the blood stains comes to the lab. They take the money out of my account. So. But they also send it to all my clients all over the world, which is fabulous.
Yes. Okay. Let's see. Another question is, as a provider, how can I access the lab to order the kits?
call them. They do have a website, and connect with them and register. I mean, this is I did this so many years ago when the fit test was fairly new, so 12 years ago, and I have an account there, I guess. I don't know how it works now, and talk to them every day. So, and yeah, it's easy. Go to their website, KBMO Diagnostics, or call the lab. The phone number is there, and then you can start working with it.
Yeah, they've been great to me. I honestly, they even will help you learn about. So there, we didn't talk about the supplements. There's a patient one is one supplement company that has helped me quite a bit with my digestion. But they kind of help you learn about the different supplements that will help certain things like leaky gut and Candida. So that they've been training me on that, and also my staff. And yeah, I think to be a holistic provider, to think globally about your patient's life and health, nutrition is something we don't think of food as medicine, but it really is. So and the more we know about it, the better. I think we can really help our patients. There's and if you're someone that is trying to help patients get healthier, this is something that has really opened my eyes to improving people's health in ways that you never thought you could, because people just don't know about this type of thing. So one question was, can physical therapists order this test? Yes, they can. I've been ordering this test for patients and having no problem doing that. So yes, Desiree. Silke, thank you for being with us and sharing so much insight. If you've been wondering whether your food is helping or hurting you, I hope today's conversation gave you clarity and hope. You want to visit the www.simplyholisticnutrition.com to learn more about Dr. Silke's practice, or book a session with her. So let me now just thank you, Silke. I'm going to just share my screen and show you just a few slides that I think are important. If anybody's interested in learning more about breathing and stabilizing your throat and breathing through your nose and improving your overall posture to reduce head and neck tension, headaches, TMJ, tinnitus, dizziness, all the stuff that we deal with in life, I've created a course called Intro to Airway Eval and Treatment. This is where you can go to register for it. But I've integrated Buteyko breathing method. I've integrated postural re-education and airway throat training. It's like basically PT to the throat to stabilize our throat so that we don't clench and we don't snore. So that's what I've been up to for the past year. And I'm very proud to say that I'm going to be teaching in Chicago starting September. I'm going to be teaching in Bethesda, Maryland, and also Calabasas, California, with the Breathe Institute. So that's that. This is all of wonderful Silke's, all of her credentials. I had this earlier, and her gluten-free practitioner program. For the next podcast, I wanted you just to know when it was going to be so that you could register now if you'd like. July 15th, Dr. Dwayne Grummins is going to be sharing some amazing knowledge. I met Dr. Grummins at a Rockabato conference. This was back in 2013. So I've been, collaborating with him for many, many years, and he is a dynamo and someone so versed in breathing and the mouth and how it all connects as an orthodontist. So this is going to be a really great podcast. So I hope you can join me there. And also, if you're interested in Chicago coming up just next month, it's the ADA Children's Airway event. So I'm going to be lecturing with all these wonderful practitioners here at the bottom of this slide. And you're going to be learning from me how I stabilize children's breathing health, and any child that is a mouth breather or a snorer or has headaches or TMJ or clenching issues, that's what I'm going to be going over here. And it's in Chicago, and it's July 24th through the 26th. This is where you sign up. Really excited about that. And I think that is all. If you want to be on our mailing list to get any of these future podcasts and information, I'm always putting out a monthly Breath of Fresh Air newsletter. So thank you so much, everybody. I will see you in just next month, July 15th. Dr. Silke, I'll give you a call in just a minute. I appreciate all that you've done for me and my family and my patients. Thank you for your time.
Thank you so much, Dr.
Yes.
Jenny. Thanks a lot.
Yes. You're welcome. You're welcome. Bye-bye, everybody, and see you next time. Take care.
Thank you for listening to the Breathing Lab with Dr. Jenny.